Okay, great. So thank you everybody for joining this session. We're really excited about engaging with our stakeholders nationally. And guys, I know everybody is able to talk, but please make sure you're muted now. So that there's everybody can hear clearly. Okay, great, thank you. So thank you everybody for joining us this afternoon. Again, we're really excited about reaching out to our stakeholders nationally and internationally to talk a little bit about the Global Digital Health Partnership Cybersecurity Work Streams draft Medical Device Manufacturer Internet of Things Code of Conduct. And the purpose of this presentation is to kind of give you an overview of the Code of Conduct itself, and then talk a little bit about why we're engaging with you all in the industry, our federal partners, our global partners, and the like throughout the sector. So, why isn't it trying to? Oh, they can take that. All right, good, great. Okay, so our agenda for today is to talk about the GDHP and the cybersecurity work stream. For those of you on the session that may not be familiar with the GDHP, and it will just give us a quick background and backdrop of information of the partnership that's working on this deliverable. We'll also want to discuss the actual medical device manufacturer Internet of Things Code of Conduct, be an overview, talk about the goals, and then talk about what we're looking for in terms of stakeholder engagement. So for those of you who I'm sure most of you are probably familiar with the Global Digital Health Partnership, but I'll just give a quick overview. And I won't, again, read all the words on this slide, but they'll be available for you on our website. But the Global Digital Health Partnership is a global collaborative that's been in operation since 2018. Right now, India serves as the current secretariat for that global work stream. There are many countries that participate in the work in the Global Digital Health Partnership in and of itself. And it is constantly growing in terms of partnership. So they generally meet twice a year at summits to get together to talk about each of the work streams, the work that they're doing, and talk about looking ahead and how to further the goals of each of the work streams for health overall, for the health industry overall. The work streams that the Global Digital Health Partnership include are interoperability, which is chaired by our own national coordinator, Dr. Rucker, the evidence and evaluation work stream, the clinical and consumer engagement work stream, and the cybersecurity work stream, which is co-chaired by Portugal and Hong Kong, who I believe are participating in this call. Thank you very much for your support and being a part of this webinar. And for those of you who might be interested in learning more about the GDHP at the detailed level, we have a link. If you feel free to visit our site, healthit.gov, and under the International Health IT Collaboration, you will find out more information about that, about the GDHP in general. The cybersecurity work stream is the work stream that I participate in, that Lisa participates in from the U.S. perspective, and the work of that work stream, the deliverable of that work stream, the IoT Code of Conduct, is why we're here talking today. So that cybersecurity work stream is focused on strengthening practice and procedures for healthcare with related to devices, health IT. We are focused on providing guidance and sharing and information sharing that will help all of our stakeholders nationally and internationally protect patient data and protect against the risks of attacks and threats against that data. So the Internet Code of Conduct Overview, an overview of the document is, so the impetus of us working on this was definitely all of our member states' concern around the Internet of Things and the challenges that we're faced with implementing these devices, medical devices, as we're becoming more and more interconnected in the health sector. So, of course, one of the concerns about that is the securing of Internet devices, the challenges that we're faced with securing these devices. Particularly from the perspective of the gap from the manufacturer side of the house, we felt that manufacturers largely were focused upon the functionality of these devices, convenience and getting them to market, and not necessarily as focused on security as a big performance factor in terms of device manufacturing. So, so one of the things that we definitely were concerned about was medical devices being concentrated, development being concentrated around patient safety. And there's a definite need to ensure that we're not only just worried about the patient safety, but we're worried about the data, and we're worried about the integrity of that data, and we're worried about the availability of that data when we're talking about these medical devices. So being cognizant and ensuring that the manufacturers themselves are cognizant of the cyber risks that can affect patient safety was sort of a way to have them connect the dots between patient safety and cyber risks. If they understand that these risks can actually indeed impact patient safety overall. So what we were hoping to achieve with the code of conduct and the goals of that was, one, to raise manufacturer awareness on how they can affect and improve the protection of their systems, the data, and patient safety by incorporating technical safeguards in their devices during the design phase of their product. So pretty much one of the baseline discussions in this framework of a document is having some of these considerations in the beginning of the process and not after market or post market. We also want to be able to provide a baseline cybersecurity guidance document and recommendation considerations throughout the device system development lifecycle. So as we walk through the conceptualization, the design phase, the testing phase, the rolling out phase, that security is actually being thought of at each step of those phases, as in other industry IT development markets. We want the guide to provide recommendations to build and or enhance manufacturer corporate cybersecurity programs. So some manufacturer cybersecurity programs may be mature, and maybe this code of conduct is a tool that they can use to help them engage with their potential and current customers that they can, use to mature their programs, establish policies to mature their programs. And some manufacturing companies may be smaller, and this would be a perfect baseline document to help them implement or begin to implement and start to begin to consider some of the security ramifications around the development of their devices. We also want to include recommendations for standard risk management practices, policies, and procedures that will provide a solid cybersecurity practice foundation. Again, making sure that we're doing the work in the front beginning of the process of developing cybersecurity programs within the organizations that are creating and deploying these medical devices, ensuring that they understand that a good foundation of that are the policies and procedures that they're going to adhere to organizationally to ensure that they are protecting and preparing with the intent to have the data that will be processed and stored by these systems protected. So for the meat of our meeting today is the stakeholder engagement. So I'm going to go back to talking a little bit about the GDHP. During our 2019 Hong Kong GDHP Summit, that was the GDHP as a whole, and the work stream discussions around the Internet Things Code of Conduct, the Secretary and workstream leads discussed the imperative for the Internet Code of Conduct and the ideas and thought that it would be really impactful if we would incorporate sector feedback while this work stream is trying to mature this document. They thought that it was just that important that we should take the time. One of the goals we had for the last year's summit was to sort of finalize our document and then kind of go forward with iterations. But the Secretariat and the work streams themselves, our chairs and our participants, thought, hey, this document is impactful enough and big enough, and we think that we should just go ahead and before we close it out, let's mature it. Let's get the sectors, our member states, countries, and all of our industry and partner stakeholders to take a look at it and weigh in on it. And see how we might, what we might want to do to incorporate in this document to get it to a mature state. So right now, I don't know if you were able to download the PDF documents that's out there yet, but if not, you will be able to at the end of this session. But right now we have a framework. We have, recommendations. We have what manufacturers should be considering while they're developing these medical devices, and things that we're recommending that they can implement right now within their environment. But in order to get to a sort of mature version, we are looking for feedback that will help make this guide and this code of conduct adoptable by the target audience, which is the manufacturers of these devices, of medical devices. What are the things that, right now this guide is pretty much a principal document. These are the things that you might want to consider. These are the things you might want to do. But what may we add, enhance, or include to ensure that this document might be usable and adoptable by our attended audience, both here in the US, but also globally, because our audience is global. So what we've done is we've posted a draft version of the document on our healthit.gov International Collaboration GDHP site. And we've included on that site a comment form for attendees to be able to, for participants or whoever would like to take a look at the document and comment, to provide their feedback on the document. In the interest of making this as flexible as possible, we veered away from the standard comment shell and section and just kind of wanted to have our initial feedback in almost a discussion type format. So what you'll see on the feedback form is a request for any recommended updates to enhance the device manufacturer code of conduct adoptability. So what we're looking for there is, what do you think we could include in this document that would make our audience and intended stakeholders get this document, download this document and say, yes, this is something that we could actually implement. This is something that we want to include in our environment. And this is clear-cut guidance that we can easily assimilate into our current processes. The second feedback item is, what recommendations would you have on a global scale? So whomever the whoever's giving the feedback, we want to make sure that we're thinking of this not just for a specific country or specific area, but we're considering this global across the marketplace. So what recommendations at a global scale do you think that would help the adoptability of this code of conduct? And then the last comment is a general draft field that will allow, okay, I think somebody's beeping, so everybody can go on mute again. A general draft field that will allow you to add anything else you think we might be considering, but also ask questions. So I know in the beginning of the webinar, I let everybody know that one, this session will be recorded, and two, there will be no questions and answers. However, we would encourage you to include any questions in that general draft comment, but also, things that you think we as a work stream might want to think about or consider while we're, working this document towards maturation. So in closing, I just wanted to thank everyone again for participating. I want to let everyone know that this presentation, the slides, the video of the recording, in addition to the draft code of conduct itself, and the comment form will all be located on the one page that was the link for the previous site on our healthip.gov International Collaborations GDHP location. So please feel free to provide feedback. I have not yet formalized a due date for comments, but what I will say is that in anticipation of our fall summit, we will probably be looking to actually have all of the feedback in and working towards implementing them in the actual code of conduct. For the purposes of our stakeholders, we set up this initial presentation really quickly, and I anticipate that we'll do another communications push on our listserv to send out to other stakeholders who weren't able to attend, just so they know that the video itself and the presentation and the draft document itself is available for comments. So initially, I will probably take a look at comments at the beginning or the end of March. That will be my first sort of draw of all of the feedback that we've received that I can share with my global digital health constituents in a consolidated format. And then I will probably do another communications push and then another comment draw and close towards the fall of 2020. So there'll be plenty of time to comment on this document. There'll be plenty of time for your colleagues, if you'd like to reach out to them, and those who are on the listserv in our member state countries to participate in the commenting portion of this exercise. So I think, again, this will probably go out for the remainder of the year until the fall, and then our cybersecurity workstream will be working hard to mature this document in preparation for our fall GDHP summit. I'm going to stop there, and I'm going to see if Jessica or Enrique have anything else to add to this presentation as the co-chairs of the Global Digital Health Partnership.
Hello, Mickey. Pedro Batista here. I believe Enrique is unable to attend. He sends his regrets. I think he's traveling, and so because of time zones and so on, he's unable to attend or to be present in this participation. You will be looking very carefully at the recorded session. From my side, and on behalf of Portugal, we're very happy to participate in the webinar. I think right now we probably will be really looking forward to the comments and the questions that may arise from the participants. And so nothing really special to add at this point.
Thank you, Pedro. I appreciate it. Yeah, I think we are very excited to hear back from the stakeholders. We got a good participation on this event, over 100 registrants. And even in the short turnaround that we had that was more than I was expecting. So I'm very excited about the interest. And I think we will get really valuable feedback from the sector.
Yes, exactly. I think it's all about getting that feedback. And so I think you made a very clear and very effective presentation on where we are, and so I think it's really now a case of being able to use the feedback and build on what we already are doing.
Okay, great. Thank you so much. Okay, great. So please stay tuned on the healthit.gov international collaboration site, not just for GDHP, but for all of the global health initiatives that we have. Our global health leader, Aisha Hassan, will definitely be posting lots of interesting things on what ONC is doing in the global landscape. So please feel free to peruse that site to see what's going on with ONC and our global collaborations. Thank you very much, everyone, and please have a good rest of your day. Bye-bye.